Good afternoon, everyone. Thank you for joining us this afternoon on this wintry, blustery day. I'd like to welcome today Jason Thorne, our Emergency Operations Center Director, and Dr. Elizabeth Richardson, our Medical Officer of Health. So as you know, last week, the province announced its plan for the gradual and phased lifting of public health measures. These plans reopen sectors and businesses that are moving potentially in the right direction. So we'll continue to look for some positive news in that area. Director Thorne will walk through the details in terms of how that might impact city facilities and the programming of our facilities in the coming weeks. And as the city and province begin potentially to gradually lift COVID-19 restrictions later this month, it's important that community members continue to take steps to prevent the spread of COVID-19 and the highly transmissible Omicron variant of concern by getting fully vaccinated and, when eligible, get a third dose of COVID-19 vaccine. We must all continue to keep our guards up for following the well-established public health measures, including wear a tight-fitting mask properly, maintaining a physical distance, limiting your contacts and size of social gatherings, and staying home when you're not well. There are ample opportunities and availabilities for walk-ins for vaccination clinics and locations across the city for boosters, the first dose, second dose, and the pediatric vaccines as well. So you can learn more about the available locations at hamilton.ca/get-your-vaccine. And you know, as the pandemic continues to evolve, our approach to addressing critical needs within the system to support Hamilton's COVID-19 vaccine effort will evolve as well. So we remain firmly committed to continuing to work with our partners across the city to save lives, keep people safe, and administer the COVID-19 vaccine into as many arms as possible. So again, want to express my deep gratitude to our partners across the city and the healthcare system for their dedication, resilience, and strength as we work to stop the spread of COVID-19 and blunt the Omicron variant, and to continue to vaccinate and protect our community. So thank you all for that very, very important work. Stressful work, I'm sure, and everyone's getting tired, but it's important work and we need to keep going. Dr. Richardson will share more about the upcoming changes to the COVID-19 vaccine program a little later in the briefing, but now Jason Thorne, our EOC Director, will provide us some updates from the city perspective. Jason?
Thank you very much, Mr. Mayor. And I'm pleased to provide this afternoon an update on our plans for reopening some of our city facilities in alignment with that provincial announcement regarding the public health measures beginning to ease on January the 31st. I'll start with our arenas. Our arenas will be reopening to permit holders beginning January the 31st with public health measures in place and at 50% capacity limits. Our public programming will also be resuming in a phased approach starting on January the 31st. Our recreation centers will also be reopening at 50% capacity. Drop-in aquatic and gym programming will begin on February 7th. The schedules for that program will be available by February the 4th, with reservations available 25 hours before the start of each program. So this includes our pool programming, including open swim and length swims, also our gym programming at select locations, including open gym, as well as court sport programs such as pickleball. WaterFit program will be resuming on February the 21st. With the return of some of our redeployed recreation staff, we will be able to resume winter golf starting as early as today, as well as winter disc golf, subject, of course, to the weather conditions. For our senior centers and clubs will be able to reopen beginning February the 7th. The actual details of any programming will require coordination and confirmation with the board of directors at each location. And our Senior Center Without Walls phone programming will also resume starting on February 7th. At our museums, which the public will know have also been closed during Step 2, starting on February the 1st, we will reopen the Dundurn National Historic Site, the Hamilton Military Museum, and the Hamilton Museum of Steam and Technology. All other museums will remain closed at this time, given the restrictions around physical distancing, as well as some construction activities that are going on, and because we still continue to have some of our museum staff redeployed to support our vaccine clinics. With respect to our other city services, the situation remains largely unchanged from what I reported previously. We're continuing to monitoring the impacts that staff isolation, illness, quarantine, or redeployment are having on our operations. As of today, 86 city employees have tested positive for COVID-19 or are in isolation. So the new transit schedule took effect yesterday, Sunday, January the 23rd, and will be in operation until Saturday, April the 30th. So that requires, that includes a number of service level adjustments on a number of our peak routes. The details of those are available through the HSR Now app, as well as through our phone line. Paramedic staffing remains relatively stable, with full staffing available for most shifts. As of this morning, a total of 19 staff are in COVID self-isolation. While this number does continue to fluctuate, this is the lowest number of staff we've had in self-isolation since late December, so that is very good news. And at long-term care, we have approximately 3% of our staff between Macassa and Wentworth Lodges off sick or isolating. These staffing levels are stable thanks to the support of our casual team members, the overtime work, as well as redeployments. So with that update, I will turn things over to Dr. Richardson.
Thanks very much, Jason. So good afternoon, everybody. We're continuing to monitor key health indicators very closely to identify when and whether we've reached a peak or a plateau in the surge of cases related to the highly transmissible Omicron variant. Currently, we are seeing some signs that this is occurring, including a decrease in our percent positivity of those being tested by PCR. With testing eligibility prioritized for vulnerable populations and workers and their households, we continue to focus predominantly on the key health indicators of disease severity, including the rate of percent positivity, hospitalizations, ICU admissions and deaths, and the number and size of outbreaks in our highest risk settings. So the average number of daily new hospitalizations and ICU admissions does remain high. As of January the 20th, there are almost 12 new hospital admissions each day on average, and more than 2 new ICU admissions each day. The average number of deaths occurring per day has been increasing and is averaging over the last 7 days at almost 2 fatalities per day. Hamilton's rate of percent positivity is sitting at 26.8% and was previously at 31.4% for the PCR tests that have been completed. Currently, there are 80 active outbreaks going on, with 8 new outbreaks being reported and 14 outbreaks having been declared over since Friday, January 21st. As you know, as of December the 23rd of this past year, we have been focused on outbreaks in the highest risk settings: hospitals, long-term care homes, supportive housing, the shelter system, and other settings that serve the communities most vulnerable. And as always, details about these outbreaks can be found on our COVID-19 dashboard. As the city and the province begin to move towards lifting COVID-19 restrictions, as you just heard from Jason, it's important that community members do continue to take steps to prevent the spread of COVID-19 and to protect themselves against any severe consequences from the virus. This means getting vaccinated fully, including first, second, and for those eligible, a third dose of the COVID-19 vaccine. And of course, keeping your guards up and following the well-established public health measures that include wearing a tightly fitting mask properly, I should say, maintaining physical distance, limiting contacts and the size of social gatherings, and staying home when not well. As we move forward and gradually reopen, we're going to continue to be focused on administering first and second doses to all individuals who are eligible over the age of 5, giving third and booster doses to eligible populations, and of course, administering now the 4th doses for our eligible community members. Overall, 86.4% of Hamiltonians 5 years of age and up have received a vaccine to date, and 81.3% are fully vaccinated. 48% of children 5 to 11 years of age have received a first dose of COVID-19 vaccine. 13% of those are fully vaccinated. Similar to the coverage rates that we provided for those that are 12 to 17 years of age, we're going to be publishing again on our website updated results for coverage by school. And that's this time going to include not only those that are 12 to 17 years of age, but also refresh the estimates now with estimates for those that are 5 to 11 years of age. So you'll see that at some point this week. For third doses, we've administered nearly 260,000 to people across the city, and we're at 59% of those eligible as of January the 20th. You may have seen our Hamilton Healthcare Partners media release earlier today, as the Mayor mentioned, announcing that our local COVID-19 vaccine program is going to be changing over the coming weeks. Our long-term planning is happening together with our Hamilton healthcare partners and other partner organizations, which includes, of course, our school boards, to support our last mile strategy and the transition of the vaccine program towards a longer-term sustainable model. So in order to reallocate the resources that are very much needed across a very strained healthcare system, there are changes underway to support both clinical care by our healthcare partners and reinforce the COVID-19 mobile pop-up channels' effectiveness and flexibility. So these are the St. Joseph's Healthcare Hamilton West 5th COVID-19 vaccine clinic will be closing as of this Friday, January 28th. This follows on from the closure of the Hamilton Health Sciences West End Healthcare Vaccination Clinic as of Monday, January the 17th, which happened last week. And the Mountain Vaccine Clinic at Lime Ridge Mall and the Centre on Barton Vaccine Clinic will have adjusted hours going forward with continued adequate capacity to meet the current demands for vaccination through those routes. Our mobile clinics from Public Health Services are going to be attending local retirement homes to administer 4th doses to residents and 3rd doses to staff. These clinics will be increasing the access to these eligible populations over the coming weeks. So they'll be rolling out over the next few weeks. Our neighborhood pharmacies are going to continue to be a very important channel for all eligible individuals to get vaccinated. They've given nearly 25% of all the vaccines in Hamilton over the course of this entire program. It is a good time to step back and reflect on what we have accomplished together as a community over the last 2 months. In December, we saw expanded eligibility for 3rd doses to 320,000 community members. This was the most significant increase in eligibility that we had seen to date in our COVID-19 vaccination campaign. Our local physicians, nurses, pharmacists, and our non-clinical staff have brought together the best of our community. Collectively, we quickly scaled up vaccination efforts and expanded Hamilton's COVID-19 vaccination campaign in a concerted effort. And this was all, of course, in the midst of an extremely strained healthcare system overall. So we went from administering about 2,500 doses per day to over 10,000 doses per day, which we peaked at earlier this month. The addition of several large-scale clinics, community-led clinics, primary care-led clinics, as well as the Ministry of Health-led GoVax bus, and our additional mobile clinics throughout the community have all been a big part of this expansion during this period. So I want to take a moment to thank all of the partners across the city and across the system in stepping up to get more COVID-19 doses in arms during a time of great need. With the Omicron variant continuing to spread, it's an important time to transition this program now to ensure that distribution is equal across eligible populations and within the community. You'll remember that we had the last mile strategy that played a very key role in offering COVID-19 vaccines to community members 5 years of age and over. We saw some very encouraging increases to our COVID-19 vaccine coverage rates in some of our neighborhoods with the lowest vaccination rates when we began the opportunistic and hyperlocal last mile strategy last August. In fact, increases in coverage rates in those areas has been greater in many ways than other parts of the city. And I'll just give you a couple of examples. So our Crown Point neighborhood, we saw first dose coverage rates increase over 16% since the start of August, and coverage rates for those with 2 doses increased over 25%. Similarly, in the lower cities, Jamesville, Keith, Lansdale neighborhoods, we've seen an over 15% increase in first dose coverage and nearly 25% increase in 2-dose coverage. And more than 80% of community members ages 12 and over in these urban priority neighborhoods are now fully vaccinated. So we're going to continue to build on the successes of those clinics that were held over the last many months as we go forward with our partners in order to further increase protection from the COVID-19 virus across our community. With that, Mr. Mayor, back to you.
Thank you very much. And thank you, Elizabeth, and thank you, Dr. Let me get this all messed up. Thank you, Dr. Richardson and Director Thorne, for all those comments, and we look forward to continuing progress on vaccinations as well as the potential of loosening restrictions, which I'm sure everyone is looking forward to in one way or another. And so let's continue to remain vigilant and follow the public health measures in place until such time as they are lifted and additional restrictions are lifted as well. On that note, I'm just going to turn it over to Jasmine for any questions from the media. Jasmine.
Great, thank you, Mr. Mayor. We have 3 media joining us today for the briefing. So as usual, we will start with 1 question and 1 follow-up for everyone. First question to Aura from CBC Hamilton. Aura, if you're ready, you can go ahead.
Thank you. Yeah, my question is for Dr. Richardson. I was wondering, why isn't Hamilton making public the research collected about tracking COVID-19 in wastewater?
Hi, Aura. Thanks for the question. So this data is actually information that is gathered by a research group and works together with our public works colleagues. And we know this is happening in a number of communities across Ontario. We're one of them. It's not a full coverage in Ontario at this point, as it's still a method of looking at how COVID-19 is spreading through our community that hasn't been fully understood at this point in time. So for many communities, when they're looking at it and comparing it to their case rates, their outbreaks, those sorts of things, it's working very well for them from a surveillance standpoint and trying to understand what's happening in their communities. Unfortunately, here in Hamilton, it doesn't work as well. It doesn't correlate as well. And our other data that comes from other sources, our case rates, those sorts of things have proven to be a better way of tracking and doing surveillance here in Hamilton. So as the researchers look at that, work with our public works colleagues to understand why that might be the case here in our particular area, we continue to follow along and see the progress that they make. But at this point, given the fact that it doesn't correlate well with the other indicators, we haven't been publishing it on our website.
Thank you, Dr. Richardson. Aura, if you'd like a follow-up, you can go ahead.
Yes, please. Thank you, Dr. Richardson. I just wanted to ask if you could explain maybe why it doesn't work as well here in Hamilton.
Hi, Aura. That's a really good question, actually, for the researchers. And I know they've been working with our public works colleagues on trying to understand why that might be the case. At this point, I think that's what they're still working through to understand, and a great question. We look forward to hearing from them as they work it through to understand what might be different here as well.
Great, thank you, Dr. Richardson. Our next question to Sylvie from CHCH. Sylvie, you can go ahead.
Hi, sorry, it's actually Phil. We all share computers and forgot to sign out, but that's okay. So I see under this new provincial school absentee database, there's 5 schools in Hamilton that are at 30% or more of staff and student absentee. So what are the parameters that would lead to a school being closed?
Hi, Phil. Good to see you. Here is your alter ego.
Sorry.
We're we're working that through. Primarily what we're going to see in terms of closures with schools at this point is really more from an operational standpoint. So our school partners, of course, are working very closely with their staff, looking at how can they keep the school open, how can they continue to provide teaching in an environment where they may have a large number of people who are off. So that is a piece that they're working through operationally, and that's likely where we might see school closures as we go forward. In terms of looking at it from a COVID standpoint, that's where we would work with them if they're seeing something unusual in terms of what's happening in the schools. They have a number, as you know, of measures in place, from masking to the HEPA filters to the screening that they're doing, the cleaning that they're doing. All of those things are going to really help them in terms of keeping transmission low, and we're working with them whenever they have any questions about how to implement a piece, or if they have a concern in terms of a piece that goes forward. But I think primarily what we're going to see from here on in is the operational issues that may lead to a school being closed.
And I know St. Joe's doing a good job with these monoclonal antibody treatments. I think they've done over 200 of those. Have you guys heard anything from the province or elsewhere about the other treatments that could be coming in as well, whether it's the Pfizer pill, which I believe has been greenlit?
Yeah, thanks, Phil. It's good to see that they're working on alternative treatments. We know with the monoclonal antibodies, when it came to this Omicron variant, we didn't have as many treatments available to us as we'd had before that. And so the science table and all of the people here at McMaster as well continue to work on where we might go with treatment ultimately. So there is, of course, Paxlovid, the pill that you mentioned from Pfizer that is being explored as to how we can move it forward. I know our group here in Hamilton are working very closely with the province to understand how and when it can be rolled out, and we're expecting some good news on that front soon.
Thank you, Dr. Richardson. We'll go next to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the questions today. My question is for Dr. Richardson. Dr. Richardson, Hamilton has reported 24 deaths since Wednesday. It's been a big increase compared to normal. Dr. Kieran Moore said last week that he is going to review a similar increase province-wide. Do you have any insight into, why we might be seeing an increase of deaths in Hamilton, and is there any sort of similar review going on here?
Yeah, thanks, Joanna. When we look at these severity indicators, those three key ones, hospitalizations, the ICU admissions, and the fatalities, of course, are key ones that we're following as we go forward. And that's really the time order as well that they do happen in, where you see first a rise in hospitalizations, then a rise in ICU admissions, and then unfortunately what follows on from that, it can be a rise in deaths. And so we're watching very closely the numbers in terms of what we see happening, how it compares with what we thought might happen with the number of cases that we understand are going on in our community. So it is something that we're tracking, we're watching, we're monitoring those each day as we go forward. So we do look forward to the larger scale review that Dr. Moore is doing, and just as he tracks and sees any patterns across the province with the larger size. And of course, as Dr. Moore said, we hate to talk about any of these things from a statistical standpoint. These are people who had families, who were loved, and who are grieving their loss very much as we go forward. And so we'll continue to look for any trends, anything that can help us to improve the response that we're doing as they go through that review.
Thanks so much. And I think it would be you, Dr. Richardson, who'd answer my next question. There are plans for a soccer game in Hamilton with 12,000 fans at Tim Hortons Field on January 29th, which is actually before the provincial reopening. Considering the situation of Hamilton's hospitals, which just last week were on this briefing calling themselves in a very precarious position, what do you think about a gathering of 12,000 people in Hamilton at this time?
Thanks, Joanna. I think Jason may want to comment as well, but because it was definitely a question that came to all of us at the EOC, and this was brought to us by the event organizers who wanted to make sure that they were, doing their due diligence in working it through and understanding the situation with the provincial rules that do indeed allow this kind of game with a 50% spectator capacity to go forward, and also our federal and provincial colleagues who came to us as well to say, how does Hamilton feel about moving forward with these things? It's as you pointed out, our health system colleagues are talking about the strain and the stress on the system, and we're very mindful of those things and thought about these things very seriously in terms of how could this potentially go forward. So we worked with the event organizers to look at how best to implement the spirit of those rules, not just the actual by the letter rules of the regulation that are out there, and look at how to best have people physically distance, make sure that they're masked, all of those different things that could happen in this setting to make it as appropriate for these times as we possibly could in order to go forward. So a lot of work went into it. I think they've come up with a plan that will achieve those goals. We know that none of these sorts of events is no risk. There is still a risk associated with events like these where people are together, and we absolutely encourage the community to look at this. We're still recommending that contacts be limited. So if this is something that's very important to you, that this might be the place where you decide to go, as opposed to having, any other gathering or something else that you might be doing. And particularly for those that are at higher risk of severe disease, really encouraging them to stay home, watch the game from home rather than be in the stands. But we're also, quite aware in our community, people need things to look forward to. They need things to go out and celebrate in terms of where particular, important World Cup type games are happening. And so we're trying to balance those risks as much as possible for those who might choose to do so. So Jason, anything you want to add?
Just add that, as you noted, Dr. Richardson, yes, the provincial regulations do permit these outdoor events to happen at 50% capacity, but the event organizers did give us the opportunity to provide some comments on their safety plan, and they put in place some measures that are going above and beyond the minimum requirements of those provincial regulations. So with the 50% capacity, spreading that around the entirety of the stadium in order to maximize their physical distancing, how they've done their seat layouts. They've also made some modifications to how they'll be doing some of the concession and food service, again, to maximize the ability for the audience to distance, to reduce the potential for sort of any gatherings, are part of the measures that they have put in place.
Great, thank you, Jason. We have a bit more time, so we'll go through for one more question each. We'll go back to first to Aura. If you'd like a question, you can go ahead.
Thank you. My question is for Dr. Richardson again. There were reports that with the increase of hospitalizations and ICU admissions, hospitals were forced to send patients out of the city. Could you confirm?
Yeah, thanks, Aura. As they've been going through this particular wave, as happened with the wave before it, when hospitals get to a certain point, they need to transfer patients to make sure that everybody's getting the best care that they possibly can. So this is something that the hospitals do in consultation with their colleagues across the province and look at where they can reach that care for the patient in terms of what is needed. So it is something that does occur. And hopefully, you know, as things begin to come back down, we'll see that reduce over time.
Thanks, Dr. Richardson. We'll go back to Phil. Phil, if you'd like another question, you can go ahead.
I'm good to go. Thank you. I'm good.
Awesome. Thank you. Go back to Joanna. Joanna, you can go ahead.
Thanks so much. My question's for Dr. Richardson. Dr. Richardson, can you talk about what you think of the province's reopening plans? Like, are you supportive of the timeline they have put out and how, you know, what they're starting with and their plan for reopening?
Yeah, thanks, Joanna. You know, they've laid this out. I think everybody wants to have some sort of sense of where this is going to go over time. And so to lay out a plan that lays out various increments over time is a good thing. And this time we're seeing 21-day increments, of course, between those changes in the rules. So I think that's a good period of time. It allows some time to see what the shifts in learning, shifts in regulations bring as they move through them. And as we've returned to learning over this last little while, it does give us some time to see what the impacts have been from that change as well as we go forward. You know, but monitoring those numbers is going to be really key. Monitoring the hospitalizations, the ICU admissions, the fatalities ultimately will be very key as we go forward to see if we're ready to make that step through the framework that they've outlined. So I think, you know, they've also wanted to do things in a way that sounds familiar to what we've done before. So, you know, people can be clear and consistent in terms of what we have, what we've done before and where we're going to go as we go forward. That's a good thing because it's easier for people to follow rules that are clear and that they, you know, change in similar ways each time they make a change rather than having things that may be a little bit more, you know, here and there as they go forward. So those are all good pieces for it. But as I said, the most important part for me right now is just watching those numbers to see if we're ready to make those changes as we go.
Thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I will pass things back to you.
Thank you very much, Jasmine. And thanks as always to Bill Custers and the entire team of Cable 14 and Clear Cable for helping putting these great media advisories together, and to the media partners who joined in to ask the questions that they can share with their listeners and viewers. We very much appreciate that as well. And for more information on COVID-19 and the financial supports and any updates, visit our website at hamilton.ca/coronavirus. And as usual, please continue all the public health measures and get your vaccine. That is still the best reaction you could make to avoiding serious illness and protecting our community and helping us get to a more open, less restrictive society as we go forward. So please continue to follow that good public health advice. And if you need any additional information, you can go to the city's website at hamilton.ca/coronavirus and follow us on the social media platforms. We will be posting regular updates on all the changes that are occurring virtually daily, if not almost daily. So that's it for today. Thank you all for tuning in, and we'll see you next Monday on January the 31st at 3 o'clock. In the meantime, stay healthy, stay well, stay warm, and continue to keep active.